Alright, in this video I am going to show you how to do your breast check-off using the model and some of the tools on your machine. So the first thing that you're going to be given for your check-off is a random mammogram. There are 4 of them and they will look like this, and you will have to read your mammogram. So let's take a look at this one as a practice. First, we're going to look at what side we are looking at. We know we're looking at the left breast, so that is the breast that we will be working on today. Our MLO view then tells us that it's above the nipple, so on the upper half of the breast. Our CC view tells us it's on the lateral side, so the upper outer quadrant of the breast. That is the quadrant then that you will sweep for your checkoff. We do need to also label appropriately for our checkoff, so we're going to use the mammogram to create our correct label. So looking at the mammogram back at the MLO side, we can kind of look at that, place our numbers here. We know that the nipple is 3, 2 o'clock here, 1 o'clock, and noon. So we can say that on mammogram, this lesion is probably about the 1 o'clock position. But we know that when we go to ultrasound, we need to apply MULD, medial up, lateral down. This means that we're going to move this lesion from 1 o'clock to the 2 o'clock position, and that is where we are going to scan. So you'll head over to the model and you will do a history with the model. Hi, my name is Molly. I'm an intern here in the Concordia Ultrasound Department. Can I please get your full name and date of birth? Thank you. I want to go over a little bit about this exam so you know what to expect. First, I'm going to have you lay down on the bed on your back, and you're going to take your left arm out of your robe and place it behind your head. I'm then going to have you roll up onto your right side, and I'm going to place this pillow behind you so you're just slightly rolled onto your side and are comfortable. Once I begin scanning, you'll feel me scanning with the gel and the camera, and it's going to take me about 10 minutes to get all my pictures. We take lots of pictures, use all the machine tools so we can get a really good image of the area. When I'm done, I'm going to show all of these images to the radiologist. They will review them and compare them to your other imaging. We'll both come back, take a look live, and the radiologist will be able to give you a preliminary result before you leave today. Do you have any questions for me? So that's just a really basic history, gets to the point of everything. The key is confirm the test that you're doing, confirm their identifiers, make sure that the patient feels comfortable, and make sure that the patient feels informed. So when you are scanning them, like I said, you're going to be scanning your quadrant that has been determined by your mammogram. And when you start scanning on the model, I want you to make sure that the gain is set really high. You can see in the bottom here there's these bright echogenic reflectors. That's going to be, we're going to call that our posterior retromammary wall. That'll be the chest wall below it. As I'm scanning, and I'm using a decent amount of pressure, we've got some more kind of little reflections in here. They're kind of hard to see. Again, this is not perfect, but it's something. So we kind of have these low level reflections in here. I don't know how well you can see them on the video, but they're going to help us just to pretend that this is actually breast tissue. So I'm kind of up in that left quadrant. We can see there is a lesion right here. This is just some saline that I injected in, and now it's just kind of this weird pocket of air probably. So we're going to call that our lesion today. The mammograms will match up with lesions that are in the breast, so you shouldn't have to make anything up too much. Again, this is all just kind of practice to get used to scanning a breast and how to label it. So the first thing that we need to do for our image is to label our side and our quadrant. Let's bring that down. So always label your side and label the quadrant that you're scanning in. Okay. So when you do your sweep, you can do a radial sweep. So we can sweep around the breast radially, and then we're going to do that transverse sweep along with it. Or you can do, like we learned in our videos, you can do that side to side, up to down sweep. So you can go side, down, side, down, and then you have to make sure you're going this way as well. Okay, That's all you have to do for your sweep. Just show us that you recognize how to do a sweep and that you're in the appropriate quadrant. Now that we've done our sweep, the next thing that we're going to do then is focus on the lesion. So again, we're going to find our lesion. Remember, it was at about the 2 o'clock, so right here would be about 3 o'clock. I'm sweeping in. There it is at 2, 1 o'clock, and then noon is straight up and down. Make sure that your breasts are slightly angled out so that tail expense is off to the armpit area. But I'm going to come back to that 2 o'clock. I'm in the radial position, and there it is. So we need to center that on our image. And again, do your best just to get a nice, somewhat logical picture that might look like a lesion out at the 2 o'clock area. Okay, so I'm going to freeze that and I'm going to finish my label. So we've got that. We need to put in 2 o'clock. We also then need to measure how far away from the nipple we are. If there are not rulers in the classroom by the time that we do these check-offs, one thing that you can kind of estimate with is if you look at a ruler and you look at how long your probe face is. This one is about, kind of hard to see on here, 1, 2. So this one is about 4 centimeters long, 5 centimeters. So if I center my lesion and guesstimate about halfway through, I can guess that this is probably about 3 centimeters, 2 to 3 centimeters from the nipple. However, if we do have rulers, I do want you to pull out a ruler, place the corner of it on the nipple, measure to the center, and get your actual measurement. So we'll finish our labeling. And the very last thing that we need to add in is that we are scanning in the radial plane, right? So you'll then save that image. The next thing that you need to do then is measure. Now when we are measuring our image, we measure first parallel with the chest wall for our length. And then we are going to measure AP. Again, do your best just to get to the board as we want you close to the correct measurements. And then we'll save that picture as well. Next, we are going to turn into our anti-radial. So if this is radial, anti-radial is 90 degrees from it. You'll again want to find that lesion, kind of sweeping through that area, find where it's largest, and freeze. Make sure to change your label. And now we are scanning in the anti-radial plane. So we'll save it again, and then we're going to measure. All right. Now the next thing that you need to do is use a couple of the machine tools. So we're going to use color, and we're going to turn our harmonics off. If you kind of fade back into the radial position, then you need to change your label. So make sure that you either stay in anti-radial or that you change your label to match the plane that you're scanning in. I'm going to stay in anti-radial. I think it's easier to stay on the lesion that way, and then I don't have to change anything on my label. So the next thing I'm going to do then is turn on my color box. When you put your color box on, you want to center your lesion in the color box. There is no flow in this, clearly, so we're not going to see any flow, but just make sure that your color box is centered and that it looks nice. When we are scanning real breasts, we would want to make sure that we find an area in the breast that the color box is sensitive to showing that flow. So when we bring the color box onto our lesion, then we know that we're assessing everything set up appropriately to assess vascular flow within the lesion. So you're going to save this color box picture. And then the last picture that you need to take for your checkoff is to turn harmonics off. So we're going to go live again, we'll take our color flow box off. Again, I'm going to stay in the anti-radial position, and I'm going to turn harmonics off. Now when you turn harmonics off, that really changes how the picture looks. It'll change how the lesion looks in real breast tissue. Does it start to look like it's filled with something? Does it change how the shadow looks? It'll give us a different look on the characteristics. But when we turn harmonics off, we need to label that on our image. So that is the last thing that you need to do. To let the radiologist know that you've changed parameters. Now I just want to show you another example here we talked about in the lecture. Again, this is not part of your checkup, I just want to show you. We talked about in the lecture how there are different things that we can change around. I'm working on a GE machine right now, but they call it the X-beam, and that is actually the compounding, the spatial compounding that we get, where multiple pictures are kind of put on top of one another, and that's supposed to help get rid of shadow. So I'm going to turn X-beam off, and it doesn't change a whole lot for your picture, but it would be more obvious if there was some sort of shadow or acoustic enhancement behind this. So that's another thing that we sometimes turn on and off. Of course, labeling again on the machine, but that's what we did just to show those characteristics a little bit more. All right, so that is your checkoff. Again, it shouldn't take much longer than 10 minutes from mammo to finish. And it is basically assessing, do you understand the basic concepts of what we're asking you to do for a breast ultrasound? When you're done completing your ultrasound on the model, you're going to then fill out a tech worksheet for your findings. So grab your tech worksheet and you'll fill this out. This is going to look awful since I am doing this by hand. Put in your name, date of birth, age, all of this. All of this will be from your patient history mammogram information. So you can grab that off of there. Make sure to circle female. You're going to put in the date. And then you're going to circle which breast you did. All of you will be doing unilateral breasts, so make sure that you are just choosing the correct one. And then I'm not going to write all this in, but usually I would write in here like follow-up mammogram, follow-up diagnostic mammogram, area of concern on left breast from mammogram. You have options. All right, and then we'll go down to the picture here, and you're going to draw in your lesion. So mine was in the left lesion at about 2 o'clock. So I'm going to draw in just this little lesion here. And one place that I worked that I really liked what we did is we kind of drew an area around the area that we looked through and then colored in where the lesion was. So I think that just helps the radiologist, especially if you take those kind of representative pictures through the area. You're not doing that for your checkoff, but if you take those representative pictures, then you can kind of show them this is the area that all those pictures are from, here's the lesion. And then we'll go down to the area. I'm just going to cross through right breast because we didn't look at it. It wasn't even an option day. It's not that it's negative. There might be something over there. We didn't look at it. Cross it off. And I'm going to go down to the left breast because that's where we were today. So I'm going to write a positive over here because I have something that I need to make a note about. And there was only one area that we looked at, and it measured, I don't remember offhand, I think it was about 1.4 by, we'll just say 1 centimeter because I can't remember what the measurements were, by 0.6. Remember to round to the nearest tenth. For your measurements, it was at 2 o'clock and it was about 3 centimeters from the nipple. Down here then is where you would describe what the lesion looked like. For this one, I would probably, actually for all of them, you guys can write hyperechoic, irregular borders. You don't have to write a whole lot more than that. If there was shadowing, I would definitely mention that. Or if it was a cyst, I would write an anechoic thin-walled structure with posterior enhancement. I would use those descriptors that we use for ultrasound. And that's really about it, so don't forget to write your description in here. When you're done with that then, you do need to present to the radiologist, or the instructor in our case. And so once you go up to present to them, you just say, "Hi, I scanned Miss So-and-so following up her mammogram from today. I found an area that corresponded with the lesion on mammogram on the left breast in the upper outer quadrant at 2 o'clock. It measured about 1.4 centimeters." And that is all you really need to do. The radiologist will be able to see your pictures. Usually they have them up, they're flipping through them. They can visually see what they look like. You just want to point out that you are cognizant of that area as well. When there are multiple lesions, or if you think you saw something that looked like a lymph node, that's kind of where you're going to get more into discussion. Like, well, I saw something, but it looked more like a lymph node. This is why I think it looked like a lymph node. Or if you're scanning through, maybe you found this lesion, but then there was other cysts in the area. You might say, I saw the area that you were concerned about by mammogram, but there's also some cystic appearing spots in the breast too at 3 o'clock. Or, you can add on to it, but again, we're just keeping this simple for the purposes of checking out. Get to the point of your checkout, and that's really all you need to do.